Hello there, this is Dr. Lema at the Health Channel. Thank you so much for taking time to watch this clip. Today we're gonna talk on autism spectrum disorder, specifically for children. And we're gonna discuss on how many levels are there, how you can tell that your child could be having autism, who are at risk, and also some of the interventions that can be done so that your child will have the best out of life. I really hope that this video is helpful to you. So autism spectrum disorder is a condition related to the brain development. And usually the impact is usually on the way the child perceives. And as a result, they have challenges in their social interactions, their communication, and their behavior. And sometimes they may also have some repetitive, restrictive movements. We are going to discuss the details of all that as the video progresses. The diagnosis of autism can be done as early as 1 year, the first year of life. But usually the final diagnosis should be done by the time when the child is 18 to 24 months. But usually by the time the child is 6 months to 1 year, you may have some light that maybe my child could be autistic based on the milestones that are expected of a child to achieve, the social milestones, by the time when a child gets to 1 year. So it's said to be a spectrum because it has two extremes. The level 1 being children who are almost normal, to level 3 being children who are severely impaired, and these are children who have to literally depend on someone else for them to be able to perform their daily tasks. So the level 1 autistic children usually have noticeable communication challenges and social challenges. They can ask for something, but they cannot maintain a conversation, like their normal back and forth conversation when you expect, for example, from a 2, 3, or 4 year old. But they can ask for something. With great support and the necessary intervention, these children can live an almost near normal life. Then you have the level 2 autism. These are children who need some significant support, and they also need occupational therapy. For these children, if they are taken in for occupational therapy early enough, they will be able to perform their daily tasks, things like brushing their teeth, dressing up, feeding themselves. They will be able to cook, like just the general things. And if their talents are nurtured toward a certain direction, they can also live a near normal life with minimal support. Then you have the level 3 autism. Is the most severe form of autism. They have verbal and non-verbal challenges. They have challenges in their social interaction. But however, still, if intervention is done early enough, even though they will need significant support for them to perform their daily tasks, it's much better than if they are just left alone. So just from that, it means early diagnosis and early intervention for a child with autism is very, very key when it comes to the quality of life these children are gonna lead later in life. So who is at risk of getting an autistic child? Usually autism runs in families. There's no known cause, as in there's not just one cause of autism. However, genetics play a role. So if in your family there's a mutation and you carry an autism gene, chances are you're gonna have a child who is autistic. Sometimes mutations can happen due to some other environmental influences, things like pollution, infections, or even medication one takes when they're pregnant. They can predispose their children to getting mutations. However, there's never been a link between MMR vaccine and autism. I know at one point in time this has been a hot debate, but as of now there is no link between MMR vaccine and autism. So who are at risk? A boy child is at risk 4 times compared to a girl child. That means chances of having a child who's a boy a child who's autistic and they're boys is actually 4 times compared to girls. There are more autistic children who are boys compared to girls. And also the other risk sometimes is usually having children at a later age, especially for women, that can risk you to getting autism. But again, that is only a factor if all these other things are also present. So how soon? We say autism presents quite soon, in the first year of life. But what are the things that you may see and may trigger you to think maybe my child could be autism? We see the social milestones. At 6 weeks, you expect your child to smile at you. Not to smile, to smile. We call it a social smile. Then when they get to 6 months, they'll be smiling at you. So if they get to 6 months and they are not smiling at you, if they get to 9 months, they are not copying any facial expressions. If they get to 1 year, they are not babbling or cooing anything. They get to 14 months and they cannot point at objects if they need to. If at any point from 6 months onwards they have very poor, 9 months onwards they have very poor eye contact, that's also a problem. If they cannot say any word, any single noun when they get to 16 months, that could also be a problem. When they get to 18 months, you expect them to play imitative plays. If that doesn't happen, that could be a problem as well. When they get to 2 years, you expect them to talk of 2-word phrases, things like go toilet or nataka chakula, nataka maji. If that doesn't happen, that could also be a problem. Some children will develop normally and then all of a sudden they'll stop, and they either start regressing or they stop gaining new vocabulary. Then that could be a problem. So we see the main areas that are affected for autism are 3: the social interaction, the communication, and the behavior. So on the social communication interactions aspect, you will know as a parent now, you'll be able to know that you'll be talking to your child, but they seem not to be there. You are not even sure if they can hear you. So you might even be calling their name, they don't turn, they continue to do whatever they do as if you're not even talking to them. Also, they don't like cuddling, they prefer being alone. They don't like pretend plays, they don't like sharing. They cannot go and get like a toy so that they are able to share with other children. They don't start a conversation. Again, this depends on the age of a child, but you'd expect, let's say, a 4-year-old to start a conversation. They cannot start a conversation, and even if they can't start, even if they are to say something, they are either asking for something or they are labeling. So they are either telling you that's a tree, but they cannot tell you a story around that tree. The other thing is that they speak with an abnormal tone. They usually say they speak robotish because there's usually no feelings attached to whatever they're saying. And then the other thing also they repeat words and phrases even though they don't know what they mean, and sometimes they don't even know how to use them in a sentence. For example, maybe they went to school and maybe someone fell in school, so they'll come and tell you, I'll just use an example, John fell. So when you see they're trying to communicate, but so when you come and say so your child will just tell you John fell. So who's John? John fell. Where did John fell? John fell. So they only know those phrases and they don't know how to use them to make a conversation. Depending on the age of a child, some will know what the phrases mean, but some will not even know. Maybe they'll just overhear a phrase, then they'll just take it, and then they'll start repeating the same phrases over and over again, even when it's not appropriate for it to be appearing in that part of a conversation. The other thing is they don't know how to approach social interactions. For example, you bring them to a group of other kids playing, they will not know how to to approach those other kids. You see, other children will just sit there and then they start playing and sharing and all that, but then these kids will either be aggressive, like too aggressive in such a way all these kids will just back off, or they'll be destructive in such a way whatever was going on there will have to stop because now he's in, or they'll just sit quietly and do their own things aside, like they'll just be passive. The other thing is that they don't recognize nonverbal expressions. For example, if you're mad at them and you're not telling them you're mad, they will not get it. Or if you change your voice, the tone of your voice, they won't get it. Or if you sit in a body posture, they also they don't. So the emotional beat and the fun beat of maybe different people doing something, they also don't get it. And then on the behavioral aspect, they usually have repetitive movements. So usually what happens is they can be doing, like whenever, maybe even sometimes in class or they're doing the field playing, you just see them doing something repetitively, or they can just be doing hand flaps. Just do that. They'll just do that as they look at other things. Or sometimes they can be things like biting or head bagging, especially when they are annoyed or when they feel that they are pushed to the extreme. They do head banging and also do a lot of biting. They don't like change, and so they develop very specific rituals or routines, and changing them can really be an uphill task for them. So with them, change has to be quite gradual, and they have to be involved in every area, and you have to get their consent. Sometimes you can push them a bit, but it's not very easy as compared to any other child. And they have problems with coordination, and so the way they walk, it's very easy for them to fall. So running also becomes a problem. You kind of think they walk a bit clumsy, or like a robot, like the way you move your left arm and your right leg, and then your left leg and your right leg, like that, because you're supposed to walk in the opposite direction. Like when you lift your right arm, you should also lift your left leg. But then with them, they walk like the way we see robots walk. They are usually unusually sensitive to light, sound, and not to pain or to temperatures. And then they like to focus on one thing. This is a strength rather. They are excellent when they focus into one thing, and they love the details of whatever they are focusing into. Though sometimes they will not even understand, and that's when now these interventions come in, because they love details and focusing on one thing. Once they are able to, as a person giving them therapy, once you're able to identify this is one of the strengths that you can really build on, so that you are able to make them great people later in the future. And then the other thing, because of not lacking change, they even have very specific food preferences. Sometimes even the texture of food, you give them some type of food, they'll just vomit, or they'll just want to spit. So as they grow older, the ones who have level 1 autism, most of the time they are able to eventually integrate themselves into the society, into any other class, and they grow with their peers with very little, if any, support. But then with the level 2 and level 3, they usually need more and more support based on how bad their autism is. So having said that, how do we handle these autistic children? Then once you've stayed with your child, you've watched this video, and now you might think, okay, maybe my child could be autistic. The first step that you can do is actually take your child to see a pediatrician, express your concerns, observe your child. If possible, if you think you've seen any of those things, you can even do a video record and share with your pediatrician, so that they are able to know exactly, because sometimes it's difficult to put words into some of these things. And then once your pediatrician has taken detailed history and maybe has also observed some of the things that you have also observed, they'll refer you to a developmental pediatrician because the management of autism is, we call it a multidisciplinary approach. So you'll need a developmental pediatrician, and then the developmental pediatrician will send you to do some tests, because sometimes autism comes with other issues that affect the brain. So they'll have to confirm if your child can actually hear, and it's not like just like we said sometimes you can be talking to them and you're not sure if they are really hearing what you're saying. So it has to be confirmed that they can actually hear, that their brain is actually perceiving the sound and interpreting it appropriately, and then they are able to speak, like they are not dumb. So all these things have to be done through your developmental pediatrician. And once that is done, then based on the findings, will be taken to either speech therapist, and what a speech therapist do, they'll start training them on the simple nouns that are at home. So things like chair, table, spoon, fork, cup, things like the things they use daily, on daily basis. So that's what they do. And then there's the recognition of the nouns, and then the pronunciation aspect of it. And then you'll also be taken to a behavioral specialist, a psychologist, and what they do is they'll have to sit with your child, observe them for sometimes a day or two, be able to identify the gaps that are there in this child's behavior, and then put up a plan which will be individualized to this specific child, and strategies on what has to be done so that they are able to feed on the strengths of this child, as they also, if the strengths are there, and then they have to be fed, so that at the end of the day this child will also be able to live an almost near normal life. Then the other person that they have to work with is occupational therapist. As we said, if they are level 2 and level 3, it's very important that they involve an occupational therapist, because the daily tasks, things like brushing teeth, bathing, feeding themselves, removing things from the table to the kitchen, these children have to be trained by an occupational therapist. Just the normal home training that we do for any other child might not be very sufficient, because again, we say the perception, the way they see things is different from most of the people. When they get to go to school, it's time for them to go to school, you might have to involve an educational psychologist, an educational specialist. Again, they'll have to sit with your child, identify their learning style, because you see, these children, it's not that they are dumb. They're actually, some of them are very, very intelligent, but then the issue is they don't learn like most children. They have a different learning style. Some will have to touch things, some will have to feel things, some will have to actually see things for them to be able to learn. So this thing of just writing these theoretical things for them may not be the best way, like, because that's what we see in most schools, may not really be the best way for them. So once you get an education psychologist, they observe them, they put an individualized education plan with goals for each term or for each year. That's the best way to handle these children, because at the end of the day, when they finish the foundation, as they grow older, as you see it, as they grow older, they tend to interact more, and so it's very easy for them to learn. But if the foundation is not laid well, then you'll find these children having challenges even as they progress to older classes. It's very, very important. As a family, you really have to be extremely supportive to these children, because this is their home. You know them better than any other person, even if these all the other consultants and professionals come on board. So family therapy is extremely important. And what does family therapy? This means the way you treat the way you handle them, the patience that is needed when you're handling an autistic child is very different from when you're handling other children. For example, this is a 2 or 3 year old and you're teaching them to put on their pants. In a child who's not autistic, you can teach them, maybe show them 2, 3, 4 times and they master it. But if a child is autistic, you can have to show them 20, 50 times before they master it. And once they master it, even the way they do it, if the way they do it tends to be much more slower compared to either their siblings or their peers. So as a parent, the worst thing you can do to this child is actually telling them you want to help them. Helping them, number one, you're demeaning them, you're not building their confidence, and you're hurting their self-esteem. They should be given a chance to do something, make the mistake as they do something, because that's the only way they are gonna learn. If you're not patient enough and you think you're helping them by actually you taking over whatever they're supposed to do, it's really, really hurting them. And as they grow older, it will even come to hurt you even more. So as a family, learn how to handle, if you have a child who's autistic, or if you have their siblings, they should be taught how to handle them. Patience is key, because that's the place where you build self-confidence and you build the self-esteem of these children. The role of medication: there's no medication for autism spectrum disorder. If a child is born autistic, they'll grow like that to adulthood. However, some, based on the level, for example, the level 3 come with all these movements, some aggression, anxiety disorders, or any other mental disorders that come with it, then at this point in time, medication is indicated, and you might have to be referred to see a neurologist, a psychologist, or even a psychiatrist based on other conditions that are associated with this issue. The key thing is, if you are able to handle an autistic child when they are younger, when they get to teenagehood and adulthood, it's going to be automatically much easier, because they are much more equipped and they are more confident, because you are able to identify their strengths and they've grown into become very great people. However, if these children are just thrown in a class, their self-esteem is hurt, their confidence is low. When they get to teenagehood, they become very rebellious, and it creates a lot of mental health issues, and it becomes even more difficult to handle them. So for a parent who has an autistic child, you really need to look at the full length of this child's life, like their future. What are they going to do? And it's not up to you as a parent to decide, but it's through having very close interaction with other professionals and also having close interaction with your child. You will be able to mentor them to become what they want to be, not what you want them to be. So if your child likes music, if your child is a scientist, if your child is a very curious child and they like knowing and investigating things, nurture that. Even if that's not what you had planned for them, but that is what is best for them, you'll have to nurture that. And once you do that, as they grow into adulthood, that's going to be their contribution to their society, wherever they are going to be. So having said that, I really appreciate for your time. And thank you. I really hope this is helpful. Remember to always give a comment and what you think. All the best and God bless. This is the Health Channel.